Good afternoon, and thank you for joining us today to discuss several important issues related to COVID-19 pandemic. Today, the Houston Health Department reports 189 new cases of COVID-19, bringing Houston's total to 10,507. Sadly, we are reporting 7 new deaths, bringing the city's total to 169. And of the 169 deaths, 43 are associated with nursing homes and 3 with the Harris County Jail. So the number with regards to the nursing home has ticked up. The 7 new deaths reported today are a white male in his 90s with underlying health conditions who passed away on May the 1st, so that was about 6 weeks ago. A Hispanic male in her 70s with underlying health conditions who passed away on May 29th. A black male in his 70s with underlying health conditions who passed away on May 13th. A black male in his 60s with underlying health conditions who passed away on June the 3rd. A Hispanic male in his 50s with underlying health conditions who passed away on May the 2nd. A Hispanic male in her 50s with no underlying health conditions who passed away on June 15th. A Hispanic female in her 80s with underlying health conditions who passed away on April the 18th. Wearing a face mask is critically important as COVID-19 cases continue to rise in Houston and Harris County. The city's Mask Up campaign encourages Houstonians to continue to safeguard themselves from potential exposure to COVID-19. Yesterday, we emphasized the importance of wearing masks, and myself and several other mayors from across the state are urging people to engage in a masked up campaign. We know that a face covering can help prevent the virus from spreading and protect your loved ones and others in our community. And so it is very important to wear these face coverings. Earlier today, Houston's leading business organization, the Greater Houston Partnership, held a board meeting where they passed a resolution supporting rules and regulations that increase the wearing of face masks in public venues. The organization, the Greater Houston Partnership, fully supports the steps that have been taken thus far to reopen our economy. The damage done to our economy by the pandemic is severe, and reopening is essential to every Houstonian. That being said, the reopening must be sustainable, and we cannot take any steps that will take us backwards. To ensure a successful reopening, all Houstonians should follow the guidelines from the CDC, along with state and local officials across the board, who make it clear that wearing face masks in public venues is essential to minimizing the spread of COVID-19 in the community. The Greater Houston Partnership believes that businesses have a responsibility in this effort to protect both their customers and employees, and is encouraging businesses to ensure their employees and customers are adopting health and safety best practices, including social distancing and mask wearing while on their premises. And this must be a collective, community-wide effort to change behaviors, and we cannot afford to let the infection rate spiral out of control in our city. And let me just say, in March, towards the end of April, first week in May, the city of Houston, along with other cities, but the city of Houston, were successful. We were successful in flattening the curve of this virus and slowing the progression of this virus. And our numbers, relatively speaking, were low. We don't want to undo the significant progress that we made earlier. And as we open up, and if we want to continue to remain open, then it's important that we do at least a few things that we know work. And that is put on the face coverings, the mask, and to engage in social distancing. I'm not asking for people to impose a stay-home order, not asking that. But what we are saying to people across the board, in order to keep this reopening sustainable, to keep it going, wearing face masks and engaging in social distancing are critically important. And because masks can help save lives, today I am pleased to be joined by the Ismaili Council for the Southwestern United States and Focus Humanitarian Assistance USA, Focus USA, to accept a donation of 500,000 reusable face masks. That is 500,000 face masks that's being donated by the Ismaili Council for the Southwestern U.S. Focus Humanitarian Assistance USA. Please give them a hand. And their donation contribution is coming at a timely fashion when, again, the emphasis is squarely on wearing face masks. I am grateful for the donation. The city will distribute the much-needed mask supply to our at-risk populations, community organizations, and first responders. I also want to say, and I think I've got one on myself, I also want to say a little about the organization making the donation. During challenging times, the Ismaili community has collaborated on disaster preparedness, including the thousands of volunteer hours during the recovery effort from Hurricane Harvey, for which Ismaili volunteers were recognized with the Point of Light Award. Their goal is to improve the quality of life for everyone, and that is welcome during the COVID-19 pandemic. And please help me welcome Shanila Momin from Focus Humanitarian Assistance USA and Maraj Ajani, the president of the Ismaili Council for the Southwestern U.S. to say a few words. Maraj, you're going first.
Thank you so much, Mayor. Really appreciate it. Good afternoon, everyone. We're honored to work so closely with the city to help fellow Houstonians keep our neighbors, our family, and our city's first responders safe during this pandemic. The Shia Ismaili Muslim community is proud to join arm in arm with Houstonians of all faiths, backgrounds, and walks of life, working together for the betterment of our communities. As we all know, in the most uncertain and difficult times, Houstonians come together and are at their best. As Ismaili Muslims, we believe that our faith should deepen our concern for the quality of life for all, whether it is donating and distributing protective face masks, organizing food and supply drives, restoring historic homes and buildings, or supporting access to arts. As Mayor Turner noted, we actualize our common values by serving others. Today highlights our shared ethics of brotherhood, of generosity, and of concern for the sick, poor, and vulnerable in the society. We must all contribute to life, to live our faith and demonstrate the connectedness between our spiritual and daily lives. Our worldly action are how we live our faith and our ethics. Today also highlights the power of hope. We must keep our hope for safety and security, for bright and healthy days ahead. As His Highness the Aga Khan, the spiritual leader of the global Ismaili Muslims, delivering the Brown University commencement speech, remarked, and I quote, "The right to hope is the most powerful human motivation I know. Its importance has been paramount in the history of this nation," end of quote. We are proud to work together with the mayor here in Houston and with great leaders like him, who are keeping our communities and those who serve us safe and helping keep our hope alive. Thank you, Mayor. Now I'd like to introduce Shanila Momin, Chairman of Focus Humanitarian Assistance USA, an affiliated entity of the Aga Khan Development Network. Focus effort from Houston to the farthest corner of the globe are an international manifestation of the ethics of the Ismaili Muslim faith. Shanila?
Thank you, President Ajani. Thank you, Mayor Turner. Focus Humanitarian Assistance USA with the Ismaili Council for the Southwestern U.S. is indeed honored to be working closely with the City of Houston to keep our communities safe and keep hope alive during this unprecedented time. As President Ajani mentioned, Focus USA is part of the Aga Khan Development Network and was established in 1995 as a crisis response and relief agency working both here at home and globally. Our mission is to save lives, reduce human suffering, and foster disaster-resilient communities. It is with these goals in mind that we stand with you, Mayor Turner, and all Houstonians as committed partners to the well-being of our city. A silver lining to this crisis has been the incredible resilience displayed by communities across the globe working together for the well-being of our global village. The donation of these masks will help protect more Houstonians, including our first responders, against the virus. These are the types of crisis preparedness and response measures Focus USA is supporting here in Texas, but also nationally and internationally. In 2009, the state of Texas and the Ismaili Mamad entered into an agreement of cooperation focusing on natural disaster preparedness and recovery, health sciences, and other areas of mutual concern. The agreement calls for collaboration to reduce risk and respond to threats to public health, safety, and welfare of vulnerable communities. As we grapple with the impact of COVID-19, we are reminded of how easily and how profoundly we can be impacted by natural disasters. I would be remiss, as the chair of a disaster preparedness organization, if I did not take this opportunity to remind Houstonians that disasters are no strangers to us. We must take this opportunity to better prepare and protect ourselves and our families from future natural disasters. Focus USA's efforts globally, nationally, and our contribution here today are a larger part of the Aga Khan Development Network, and also a manifestation of the ethics of the Shia Ismaili Muslim faith. It is our honor to support your work, Mayor Turner, to ensure that all Houstonians remain safe, healthy, and resilient. Thank you for this opportunity to be of service to our fellow Houstonians. May God keep us all safe and healthy. Thank you.
To the chairperson and to Mr. President and to the Ismaili community as a whole, let me, on behalf of the city of Houston, your city, let me thank you all for just stepping up again in a moment of need, and the 500,000 face masks that will be distributed to our at-risk vulnerable population in the city of Houston are timely needed. And so very, very much appreciated. And then we look forward, I think we're going to try to do one of several mass distributions this coming weekend. So thank you also very, very much. COVID-19 cases and hospitalizations continue to increase in Houston and Harris County and throughout the state. While our hospitals currently have enough beds for people who need one, we may find ourselves in a dangerous situation with hospital capacity if the trend continues. This should serve as a stark reminder to everyone that this virus is still spreading in our city, even as society reopens. Now is not the time to go out and behave as if life has returned to normal. It has not. It will not anytime soon. Let me just say that over the last several weeks, since March, May 1st, we've started to reopen, and then there have been a number of mass gatherings that have taken place over the last 6 weeks. Let me also encourage people to go and be tested. If you've been in close proximity with a lot of people, especially if you've been anywhere close to persons who didn't have their face masks on, let me encourage you to be tested. I know I went and got tested again over this weekend. I'm glad the results came back negative, but let me encourage people to do so. And then apparently there are more people who are that are heeding the call to be tested, because just today at Del Mar Stadium, one of the public sites, we reached our capacity at that site right around 10:30. So that was this morning. So more and more people are going out to be tested, which is good. And you don't have to be symptomatic. You could be without symptoms, but go and be tested, especially if you've been a part of the marches, the demonstrations, or you've been in the bars, clubs, or just been in close proximity with a lot of other people. So I want to make that very, very clear. Now, at this point, for more on this and other things, let me call up Dr. David Pearce.
Thank you, Mayor. So the Houston Health Department monitors emergency department visits, which is something we've been doing, part of a syndromic surveillance project for several years. And we watch for a number of things. We look at patients' ages, why they went to the emergency department, when they went to the emergency department. And on this slide, you will see, the slide in front of you, you're going to see what we've observed. And so what we've noticed is that in just the first 2 weeks of June, so this compares all of May with just the first 2 weeks of June. And you can see that overall, we've already had as many people reporting to emergency departments in Houston with COVID-19 related symptoms in just 2 weeks as we did in the entire month. You will also notice in this slide that the ages, the percent within the ages is relatively the same, except for the 18 to 44 age group, where it's gone up nearly 8%. So again, this goes along with the mayor's comments of people who are younger going out in the clubs and restaurants and stuff, are going in, and these are not people who are going to get tested. Remember, these are people who are going to the emergency department because they're feeling ill and with COVID-19 symptoms. So, you know, the suspicion, that what my belief is that this is because that we're seeing that, you know, that the elder people over the age of 65 is down a little bit. I think there's a couple of reasons for that. I think that that's because nursing homes are doing a really good job. I think that elder folks are paying close attention to the advice and they're behaving in manners to protect themselves, whereas perhaps the younger people, not so much. And we're going to move on to make a couple comments about contact tracing. So quickly, that's the other vital role that we do is the contact tracing. And remember to put this in context. There is a test, and if somebody tests positive, they become a case. And an epidemiologist will contact that person and do a case investigation to try and figure out how they potentially became infected and who they may have exposed. The people who they may have exposed are the contacts. We will then, the health department, we will reach out to you and try and get in touch with you. And as we have mentioned earlier, one of the challenges we're getting is that people, when the contact tracers try to reach out to them, they're not answering their phones. So if we can go to the next slide, I want to provide the public, these are the information that you'll know that you're being reached out to by a City of Houston Health Department contact tracer. So that's the caller ID, 713-853-8700. If that's the caller number that you get on your phone, that's the health department. If it's coming from email, there's the Houston email address that it would be coming from. And if you're getting a text message, it'd be one of those three numbers that the text message would be coming from. And so if you get contacted through any of these three ways, that is not a telemarketer, that is not a scam, that is not some sort of email fraud, that is a trained contact tracer who's trying to get in touch with you to let you know that you may have been exposed to someone and how to help yourself. So those are important things to jot down and remember. Thank you, Mayor.
Thank you. Mr. Williams? Okay. Ms. Moniz? Okay. Okay, so that's what we wanted to highlight today, is the fact that please get tested, please wear your mask, please continue to engage in social distancing, and recognize, as I think it was Dr. Shaw who said, you may be bored of the virus. The virus is not bored of you. So please govern yourselves accordingly.